because we are not homogeneous, we are diverse, and we have different needs, and we are all Kenyans, and everyone needs to be captured in that policy document, but unfortunately, it's not.
All right. You talked about meaningful engagement of the young people when it comes to policy development processes in the country, which probably you're going to tell me whether it's just in the health sector or elsewhere. According to I know you're majorly focused on productive health, but what is this that you're calling meaningful engagement? Is it just underrepresentation, or is it more than that?
It's more than underrepresentation, because if you are, for example, you're calling me for a meeting, today is on Friday, and the meeting is tomorrow, and you are telling me about the meeting at this time. How am I supposed to engage meaningfully during that whole process? How am I supposed to do that if I'm not given enough time to prepare and to just familiarize myself with what the discussion will be around? So you need to give people the time to go through what the meeting will be about. You need to give them the choice to decide whether to participate or not, and they need to be assigned responsibilities. You cannot call me for a meeting in the evening, you're telling the meeting is tomorrow, and you expect me to show up as a young person. I'm supposed to look for fair to show up for that meeting. I will not engage. I'll just come, sign your two papers, I was there, but go. But I will not have given you anything, honestly speaking. And it's not only in the health sector, it's happening across different sectors. Because even with the election, you can see a lot of young people, there's a lot of voter apathy, because people don't understand and they're not engaged as much. So that's why there's just a lot of mismatch when it comes to engagement of young people in our country.
All right. And for young people to be included in these particular programs and processes, what exactly do these particular bodies and authorities need to do to make sure that exactly these people are brought on board and they get to do what they need to do, especially in public participation, to contribute to these particular policies?
I think the first thing is that people need to realize is public participation is a constitutional right. We have the right to engage at that level. In as much as most of the time when you're talking about public participation, the meetings are posted on what are they called? Gazette most of the time, and people don't read. Young people don't read those. How about they go with the times? If there's a public participation process, how about they post it on their different social medias so that young people know, by the way, tomorrow there's this public participation process, they're discussing this is what your role is. You see, that way young people will be able to engage. But if you tell me, but then there's a public participation forum tomorrow, am I going to attend your meeting tomorrow or go hustle? Now, you see, also giving people time to prepare for such things is very important. And also for the different organizations and the different bodies, it's important for you to know what meaningful engagement you look like. The fact that you have Josephine and 3 others there is not meaningful engagement. But if you have Josephine, if you have a woman living with HIV, if you have a young person, if you collect young people in all their diversity and give them time to actually share their issues, that is what we call meaningful engagement.
All right. Now let's talk about something that you people are very passionate in advocating for. You mentioned a few minutes ago that the segregation of the young mothers when it comes to their health services and the reproductive health services and the provision of the same. And I have quite alarming statistics here, where about 700 teenage girls are getting pregnant daily, and this is a research that has been done over a 2-month period. In this particular year, according to the Ministry of Health, 700 teenage girls getting pregnant. Yet, according to what you said, the Ministry of Health has a bit of bias when it comes to providing services for the same people, and the numbers are increasing daily. What is being done on the ground? I know you guys are advocating, but what is the work that is being done on the ground to make sure this nightmare comes to an end?
And just to there's another alarming statistics. We were ranked 3rd in the world when it comes to teenage pregnancy a few weeks ago, which is very disheartening, because when we are looking at the data, what the ministry wants to do and what the data is saying is totally different. And I can only speak to what Youth Changes Kenya is doing and what I've seen other organizations doing. As for government, unfortunately, I cannot speak for them, because when you go to meetings with them, they're telling us work is being done, we are doing this, we are doing that, but when you come to the ground, nothing is really being done. So for YCK, what we're doing is we are having interventions that promote access to sexual reproductive health services for young people. We are currently integrating teenage girls, teenage moms back to school in Kakamega and just offering the aspect of psychosocial support for them. So that is what we're doing as Youth Changes Kenya. As for government, I cannot speak for them, unfortunately.
Okay, we know who was supposed to speak for the government. Closely related to that, you were with us live from your location last year in November when we talked about the ESA commitment to comprehensive sexuality education, which is closely linked to the statistics that we have tonight. What is the progress? Has the government committed to it? Do we have progress?
Oh God. Unfortunately not. Kenya has not committed yet, but there's still time. They have until December to recommit. So we are hoping they will recommit by then. We're just trying to have discussions with the different government heads that can sign that, the Ministry of Education, the Ministry of Foreign Affairs, just have discussions on why the ESA commitment is important as well, and also key in the aspect of the East African SRH bill, which is also very important for young people. And if Kenya recommits to ESA and the East African SRH bill passes, then it will mismatch what the reproductive health policy says. So that means we'll have to go back and write that policy again, because there'll be a mismatch between what it says and what other treaties are saying. And if the policy stays as it is, the National Adolescent Sexual Reproductive Health Policy that is under review will still have the same issues. Because even with the review of that particular policy, the meetings were called last minute. The consultation, the public participation that was supposed to take place in Nairobi, we were called to Machakos, and we were mixed with guys from Embu, guys from Kitui, and it just didn't make sense. Even the young people that were there, the few that I spoke to, they were like, as we were called, we were told there's a meeting, we go and sign. So you see, they're not even provided that opportunity to know what the meeting is actually about. So there's been a lot of, that is actually another policy that we are looking into to just make sure that it actually reflects the lived realities of young people.
All right. You mentioned a bit about what you're doing, and as Youth Changes Kenya, what are you doing in terms of making sure that especially the young ladies can get that comprehensive sexuality education from your perspective, from your abilities, in your level? What exactly are you doing on the ground to make sure that all over the country we have ladies and we have people championing for the young ladies, not just informing them, but also championing for their rights? What exactly are you doing on the ground as Youth Changes Kenya? And how exactly can one plug? Is it a closed thing, or can citizens actually plug in to help with the work that you're doing?
So we work in Nairobi, Kiambu, and Kakamega. So most of our programs are in those areas. So with Kakamega, we've trained champions. We call them champions. Since we cannot be in Kakamega all the time, it's easier to work with people that are there. So we train them on what sexual reproductive health and rights is, and then they're the ones to cascade the information to the others in the society, in the communities. The same thing with Nairobi, the same thing with Kiambu. So that is what we're doing, trainings, and then also we also offer information on social media. And it's not closed, like you cannot take part. Go to our social media handles. If you see we have a petition, sign. If you want to be engaged and to work with us directly, send us a message. Go to our social media handles, Twitter, YC_Kenya. Send us a DM, and we'll see how best we can work together. And we also we have a pay bill number that you can also contribute resources to, because we've seen people showing interest, especially when it comes to returning girls back to school. So if you have something and you do want to support, then feel free to just go on Twitter, our DMs, and we'll provide more details.
All right.
Yes.
So are you looking forward to go beyond Kenya at some point?
We just want to work within Kenya first, because there are like 3 counties. So we want to cascade to other counties, and then we will see beyond working beyond Kenya. But we do have partners from other countries. We have partners in Uganda, we have partners in Kakamega, in Tanzania, and we also have a few partners in Malawi. So we are getting support from different aspects as well.
All right. Allow me to go back a bit to the bill, to the Sexual Reproductive Health Bill, and you mentioned earlier that there are gaps. Just before I let you go, it's good for us to understand what are these gaps that are in this particular bill that you would want included, and how first do you want them included now that we have a stalemate of sorts?
With the reproductive health policy, unfortunately, it's already launched. It's out there. So the best we can do is go to court and prevent it from being implemented. But when it comes to the East African Sexual Reproductive Health Bill, it's a very progressive bill. It does cover the different issues of young people. However, it still has gaps as well. Because there's issues around comprehensive sexuality education, different governments having different definitions, people bringing their values into the whole conversation. But it's a very progressive bill. We have very progressive members that are championing for the bill. So with the bill, we are currently having a petition online to just get people to sign, to just show the MPs, the members of parliament of the East African Legislative Assembly, that this bill is important. I was in the Public Participation Forum. We were able to present a memo that we conducted with young people. So we do have a few recommendations. So one of the gaps we saw is people with disabilities were not really captured in the document as well. They were not speaking about issues around endometriosis, PCOS that affect women when it comes to reproductive health. There's a mismatch in terms of the language. There are times they're calling people adolescents, other times it's young people, other times we're being lumped up as youth. So those are the few gaps that I can point out. But we did present a memo to the Yala Assembly, so we're just waiting for feedback, and then we see how best can we plug in when the hearings for the bill start, probably towards the end of the year. If we'll go to Arusha and tell the MPs, please pass the bill, or we'll find other ways of just engaging with them. Yes.
All right, thank you so much, Josephine, for joining us in our studio tonight and talking about reproductive health policy and the gaps and the progress and the needs that the people have. Personally, I think reproductive health touches on everyone who exists on Earth today. And so we should be very much aware of what's happening in that particular sector. And my director says ERIAC. I don't know what ERIAC is. But,
ERIAC means I'm smart.
Amazing. So what? Oh, it's Jura actually. Samson Jura, one of my colleagues here.
Thank you.
Thank you. Thank you is what? Now that ERIAC.
Thank you is Erokamano.
Erokamano. I think I know that. Erokamano. All right. Thank you so much, Erokamano, for joining us in this particular conversation and getting to enlighten us on this particular topic. There you have it, dear viewer, on reproductive health policy and the gaps and what we need to be doing and what we need to be championing as being led by organizations such as Youth Changes Kenya. And we've been having Josephine Acheng, who's program lead at YCK. She'll be back to join us once again. You can be sure about that, to continue talking about this very important aspect of health that affects us all. We take a short break. We'll be right back in just about a bit. Don't go anywhere.